Hi, I'm Bobby Peer with Tap Into, and I'm here today with Dr. Anthony Terrana from Terrana Orthodontics. Welcome, Dr. Terrana.
Hey Bobby, happy Monday morning.
Yes, another beautiful summer day. Uh,
Yes.
Today, we are going to talk about indirect bonding. Technology just keeps on improving, and I'd love to learn a little bit about it, how it differs from the traditional bonding, and what's the process and what is that? How does it relate to the patient's maybe the time they're in braces? How does it improve
Oh
their
yeah. Yes.
process? So let's go.
All right. So that's a great question, Bobby. Traditionally, what we used to do, and many people still do, is they would place braces one by one, eyeballing it, gauging it as best as they could. And, tooth alignment's all about bracket placement, right? So putting the braces in the right spot. When it's on the right spot from day one, treatment time takes longer and your teeth aren't as straight. So what we do here, we use a technology called indirect bonding, where the patients come in, they take a 3D scan of their teeth, and then we upload braces to those scans on a computer. And we use computer combined with me to perfectly place those braces so we could then see an outcome simulation on how straight the teeth are going to be. And then from there, we could adjust the bracket placement to get precision bracket placement. This way, we could get perfect alignment of the teeth. That has many benefits for the patient. One, day one, you're getting the brace in the correct position, so there's less adjustments down the road, which leads to less treatment time. So indirect bonding leads to about 30% less treatment time and less office visits, which is great for everyone, right? Patients don't want to have to come here more than they should. I've had treatments that were supposed to be about 24 months, which is about 2 years, get done in about 13 months
Wow.
because of indirect bonding. And parents are kind of like, are you serious? We're done half the time. I'm like, yeah, technology really helps us these days. It leads to happier patients because when their braces do come off, you'll see how symmetrical and how perfectly aligned the teeth are, which makes them really straight. And it's also great for the patient the day they get their braces on because they're only in cheek retractors for maybe 15 minutes because all the braces were already placed on the computer. They get put into stents and those stents go into the mouth. So it's much quicker to place the braces that day. So it's much less discomfort at that initial visit.
Wow. Now, is everybody a candidate for this indirect bonding?
Absolutely. Anyone who needs braces is a candidate for indirect bonding. We do at my office, we don't do any traditional bonding any longer. It's all, you know,
Okay.
computer aided indirect bonding.
Wow. And is there any special care for this type of bonding?
There's no special care. It's the same. Once the braces are on, it's the same as having them placed the traditional way. The only difference is it's quicker to place the braces. And the day we place the braces, they're just in a better position than, you can never beat a computer's accuracy, right? We could get it pinpointed within fractions of a millimeter versus no one's eye is going to be able to, tell the difference between fractions of a millimeter. So you're really getting that perfect bracket placement day one, which just makes for a smoother treatment for everyone.
Great. I mean, this is fantastic. Now, last time we spoke, we were able to visualize. Do you have
Mhm.
something that
Yes, I could actually show you a video on what that looks like
I'm a
to
very visual
conceptualize.
person.
Yes, me too, me too. Are you able to see my screen?
Yes, yes.
Yes. All right, perfect. So this is an example of indirect bonding.
Wow.
So this is how we used to do it. We would, eyeball it and hope that it was in the right position.
This makes complete sense to have the computer involved.
Right? And as you can see, even placing the braces that day is just smoother because you don't have to wait for the doctor to place each bracket one by one and, eyeball measure and adjust. So it's a,
So with this process, it doesn't cause the brace to come off easier. It's all technology has developed.
Exactly. Yeah. It doesn't make the brace come off easier. We have a very low bracket failure rate here, maybe one or two broken brackets a month out of hundreds of braces, which is really, really low.
Wow.
So, yeah.
And so I'll go off a little bit. As far as popularity, we've talked
Mhm.
about Invisalign in the past.
Yes.
So
Yes.
now we're talking about the traditional braces.
Mhm.
Are you seeing like what's the ratio of patients that
I
prefer
would
traditional versus Invisalign?
That's
And
a great question. It definitely depends on age. I would say amongst high schoolers, anyone maybe over 13, 14 years old, I would say Invisalign's definitely more popular amongst them. And then maybe amongst the middle school kids and the elementary school kids, I'm still seeing braces to be the more popular option. Whenever parents are in, we always present both options along with the pros and cons. And we never determine for them what the best option is. We kind of see based on the parent's preference, based on patient preference, based on what responsibilities they want to have, what option works best for them, right? Some kids, when it comes to Invisalign, don't want to have to wear it 22 hours a day, worry about taking them in and out when they're cleaning, brushing their teeth. So they prefer to just have braces glued to their teeth so they don't have to worry about all of that. And then other kids, they want that responsibility because they don't want to have poking wires and broken brackets and other things. So there's definitely pros and cons to both. And I would say, based on age, I would say, and parent preference, knowing their child and what their child will do best, that kind of dictates which route we go.
that's great information. Thank
Mhm.
you so much for answering all these questions.
Yes.
And I love the technology that is advancing the orthodontic field.
It's coming a long way. So we'll
Yeah.
see where we are in another 10 years.
Well, have a great day and thank you.
You too, Bobby. Take care.